Hello everybody, I am Dr. Sunanda Chava. I am a old medicine specialist. I just wanted to speak about old manifestations of COVID-19. Since old manifestations of COVID-19, since it's a new disease, it has to be it has to be examined. The old lesions in the COVID-19 should be examined and described very well by many people. Then only we can have a full idea of how these oral lesions or what type of oral lesions occur. So coming to oral manifestations of COVID-19, before going for oral manifestations, a dentist or a doctor should first ask for history of fever, cough, loss of taste sensation, and loss of smell sensation, fever, muscle pain or myalgia or body pains, then rashes on the skin, which is called exanthema. So coming to all manifestations of COVID-19, you have to first take the history and clinical examine and then come for oral manifestations. And then any lesion without lymph node examination is incomplete. So characteristics of COVID-19 virus is it's SARS COVID-19 virus. It's a RNA virus and it has got some latency period, latency period, and then person might have prodromal symptoms. This could be body pains, fever, myalgia, headache, nausea, vomiting, vomiting and all. So all manifestations, you'll have mucositis or gingival inflammation or desquamative gingivitis. You can have an ulcer. The person might have an ulcer due to vasculitis, and even erosion, bulla, vesicle, pustule, macule can be there. And a pinpoint elevated lesion, that's a papule, can be seen. Or you can also find a plaque, can find an erythema, you can find petechiae. Petechiae or petechiae, this is bleeding points, so you can pinpoint bleeding points. This can occur due to thrombotic vasculitis or vasculopathy or due to thrombocytopenia. So a person might also get dry mouth and fissured tongue. So you say something called as COVID tongue in these patients. They'll have white patches on the dorsum of the tongue. There might be some depapillation and all, and it might become very red, and it could give an appearance of a strawberry tongue. So some pigmentation also you can see in the oral cavity. Black fungus or mucormycosis. But some people are saying black fungus or mucormycosis, that spores of this mucormycosis fungus are missing in few cases. So it could be just vasculitis and necrosis and all, because it blocks oxygen supply to the tissue. So it can become oxygen deprivation it can cause, and it can cause to necrosis and oxygen hypoxia and necrosis and all. So it's usually black in color and all. So they say that it could be due to vasculitis and not due to mucormycosis. So that it has to be investigated, and a lot of studies have to be done to see what is the black fungus and all. They have been related to use of oxygen along with water or moisture. So then you can have, the person might have halitosis, herpetiform, zoster-form lesions, hemorrhagic crust, bleeding areas, and then they can have swollen lips, throat, tongue, gingiva, floor of the mouth and all. Sometimes it can mimic angioedema also, because AC receptors are involved in the causative of these lesions, oral lesions, spontaneous bleeding, commissural fissures. Enanthema, you can see this is fever with rash on mucosa is called enanthema. Fever with rash on skin is called exanthema. So anosmia also you can tell. Frequency of involvement in mouth is tongue greater than gingiva, greater than labial mucosa, palate, buccal mucosa, oropharynx. Salivary gland involvement is often, but percentage is not mentioned in literature. Males and females are equally affected. Lymphatic involvement is present, looking like Kawasaki disease. Others are, you can see upper stomatitis, herpetiform lesions, candidiasis, thrombotic vasculopathy or vasculitis, Kawasaki-like disease or mucocutaneous lymph node syndrome, erythema multiforme, drug eruption, necrotizing, periodontal disease, angina bullosa, angular cheilitis, atypical sweet syndrome, which is neutrophilic infiltrate along with rashes on skin. And then in one patient with Merkel cell which had subsided, the Merkel